Hey guys, welcome to your stepper workout today. I am Jordan. I'm going to lead you through a postpartum friendly workout. We're going to start out on the mat, then we're going to use the bands, and then we're going to get on the stepper for the last 5 minutes. This is going to be a workout once you are approved by your doctor after your 6-week checkup. If at any point anything feels like it hurts or you are uncomfortable, stop what you are doing. Always check with your doctor. Please note that anything your doctor says goes above and beyond what I am teaching you here. This is just going to be if you've had no contraindications for your 6-week checkup, you can get started here. So we're going to start with some connection breaths that help activate your TVA and your pelvic floor to help engage and connect that healing process. And then we're going to move to the floor. And like I said, move up to the stepper. So today we're going to start in a seated connection breathing position. So we're going to sit cross-legged on the floor, wherever is comfortable. If you want to sit in a chair, you can do that too. You want to make sure that you have your ribs stacked over your hips. You don't want to lean back or lean forward too far. Sit up nice and tall, chest up, have your ribs stacked, and we're going to do 10 deep breaths. So when you breathe in, you want to fill up your stomach. So as you exhale, tighten your core, pull up your vaginal wall, your pelvic floor, squeeze together, pull your belly button to your spine, relax. As you inhale, fill up your stomach again. Exhale, push it all out. Feel that full activation, almost like a zipper zipping up. Inhale, fill up. Exhale, tighten. Keep those ribs stacked as you continue to do so. Inhale. Exhale. Tighten. Good. We're going to do 5 more. Inhale. Fill up the belly. Exhale. Tighten. Good. Inhale. Exhale. Inhale, fill up the belly. Exhale, push it all out. 1 more. Inhale. Exhale. Good. Now we're going to do 2 rounds of that. So now you can just take some normal breaths, reposition your body if you need to. Again, if this position doesn't feel great, you can sit on a chair, you can stand. There's a couple different ways you can do it, but the seated position sometimes is the easiest because then you're not worried about locking your knees and your legs and you're just comfortable. And so we're going to start again, 10 more. So we're seated in the upright position, ribs stacked over hips. Inhale, fill up the belly like it's a balloon. Exhale. So don't just tighten here, you want to tighten here too. Good. Inhale, fill up the belly, exhale. Push it out, good. Good, just pretend your belly is a balloon. Push it all out. Good, feel everything tighten. Good, 1 more. Push that air out, good. Okay, we got 5 more left. Inhale, let that fill up. Exhale. Good. Inhale, fill up. Exhale, tighten, feel that pelvic floor lift. Good. Couple more. Inhale. Exhale. Good. Feel all of this tighten. 1 more. Exhale. Good. Okay. Done with those breathing exercises. Now we're going to move into heel drops. So on your mat, you're going to move into a comfortable flat lying position. You want to make sure that you are comfortable. If this feels like it hurts in any way, please don't do it. Stop what you are doing. With this, you want to make sure that as your core starts to heal, you don't see any coning in the midline. So by that, I mean when you lift your head up, if you see your core dome, stop what you are doing, and that means that you're doing too much. So we're going to start with this heel drop, and if you start to see this dome, we're going to try to create a modification for it. So what we're going to start doing, what we want the move to look like is going to be, we're going to just put our foot out a little bit and let our heel tap the floor. So we're moving, this is going to work our hip flexors, our deep core, and our pelvic floor, and our low back. So with this is going to activate those core muscles. If you start to see any coning or doming in this midline, do not do this exercise. Just let that heel slowly tap. So what you can do to modify if you do see the doming is just pick your foot up and down here in this position. So the farther out your leg gets, the harder it is for your core. So modification would be just up, down here. So we're going to switch sides, go to our right leg. So we're going to go out a little bit, just do a heel tap. Nice and slow. Don't slam your heel on the ground. Just go nice and slow. If you need to, again, modification, just pick that leg up and down. Nice little heel tap. We're going to go back out, see how it feels. If we see any doming or coning, we're going to go back in. Good. Okay, we're going to rest there. So now we're going to do a knee drop out. So you're going to stay in the same position, and then you're going to let that knee just fall out. This is going to open up those hip flexors. Good. We're going to alternate. You're just going to let that knee fall. A lot of these postpartum exercises don't actually feel like a workout, but they are very essential to your healing and your recovery. So this should help your glutes, your low back, your hip flexors, your adductors. God, we're going to do 4 more on each side. There's 1 and 1. 2, 2. Got 2 more left each side. Let that fall. Good. The right leg fall. Good. Left leg fall. Right leg last fall. Good. Beautiful. Okay, so you should have opened up your hip flexors and started to activate the recovery of the core. Okay, now we're going to grab our bands and we are going to attach them to the base of the stepper. We're going to do the widest ones on the base here. And you want to grab a lighter resistance since we're starting out and we're just trying to build the base and the foundation of our core. And so what we're going to do is we're going to do that breath. Inhale, let that core fill up. Press it out, tighten, soften the knees, which means do not lock them. And so as you have this tight, your pelvic floor and your deep core tight, then we will do bicep curls with the band. So curl up, and we're going to do 10 of these. 1, 2, 3. Keep that core engagement the whole time. 4, 5. Good. We're going to do 5 more. 1, 2, 3. 2 more. 4, 5. Good. So the next step, we're going to unattach one side. And we're just going to grab the band 3/4 of the way down. Okay. Now we're going to grab the band 3/4 of the way down. We're going to do our connection breathing again. So we're going to let our stomach fill up. Exhale, push it out. Tighten the core, pelvic floor. Hold it tight. And then we're just going to do a lateral raise, keeping that core tight for 10 of these. Good. Keep that core tight. If you feel like you have to loosen, you can pause, engage again. Inhale, exhale, and go again. We're going to do 10 reps of these. So we're going to do 3 more. Good. Okay. Now we're going to rotate. Do the same thing on the other side. Again, soft knees, engage that core. Hold it tight. Good. 4, 5, 6, 7. 3 more. Keep that engagement if you need to re-engage. Pause, fill up the belly, push it all out. Good. Rest. Okay, now we're going to get on our stepper and we're going to step for 5 minutes. If at any point you feel like you are out of breath, you can stop and get off as soon as you need to. If you can try to push through, now is not the best time to push through. You want to stay consistent with a slow heart rate elevation. If you feel like your heart rate shoots up, you can jump off, catch your breath, and you can keep going, or you can stop. Again, we are promoting the healing process. We are not trying to push. Now is not the time to have big goals. Now is the time to just ease into it. So we are going to start. We're going to do 5 minutes. We're just going to do a slow, steady pace to get our heart rate elevated. So we're going to start here, just with a quick start here. Good. Okay. Nice and slow, steady. We're only going to do a speed level of 1 to start out with. We're going to do 30 seconds here just to kind of get our body used to it. and then we will elevate it to a 1, maybe a 2 or a 3. We're not going to go above that because, again, we are slowly easing our body into the healing process. We are not trying to overdo it. This is not supposed to feel like a workout. It's just supposed to feel like enjoyable movement, as you could say. So we're at 22 seconds. We're going to stay at 1 for 30 seconds. We're going to go up to 2, and we're going to see how that feels. So let's go up to 2. We're going to do that for 30 seconds. See how this feels. We're only shooting for a 5-minute goal. If you can't do 5 minutes, that is okay. 1 minute is better than nothing. 2 minutes is better than nothing. So we're halfway. We're at that level 2. If you feel like you are exhausted, then you've probably done too much. You want to feel leaving more energized, not more fatigued. Good. So we're at that 30-second mark. We're going to go up to level 3. We're going to see how this feels. Make sure when you step, you are stacking the ribs over your hips again. You don't want to be leaning forward like this. You don't want to lean back far like this, like you're going to fall off. You want to stand up straight. This is going to help activate the glutes, the hamstrings, and the calves. Good. Level 3 should feel good. At 30 seconds in, we're going to stay at level 3 for another minute. Nice and steady. Again, we don't want to be just fully perspirated and sweating. We want this to feel good. We want to feel like we're getting some movement in. We want to feel like we're healing at a slow process. You can't rush this process. It takes time. And some days, this 5 minutes, if you can get 5 minutes to yourself to do this, you're winning in my book. Okay, we're going to do this for 30 more seconds. See how this feels. We are going to bump it up to a 4 for 30 seconds after. We're going to see how that feels. If it feels like it's going to be too much, if 3 is already pushing it, you can stay at a 3. We're going to do this for 20 more seconds. If at any point you need to get off, there are 3 stop buttons. There's one in front of you, there's one behind you, and there's one on the screen. Good. Okay. 30-second mark. We're going to go up to 4. Good. Now's a good time to focus on your breathing. In through your nose, out through your mouth. Good. Just take it one step at a time. We're already over halfway done. You're doing great. Good. We're going to stay at this level 4 if it feels okay for you. We're going to do another 30 seconds here. Good. Stay nice and tall. Stand up. Don't let yourself lean over. If you need to at any time, slow it down. You absolutely can. Go at your own pace. Go at what feels great. We're going to stay on this 4 for 10 more seconds. Good. Again, focus on the breathing. Breathe in and out. Good. Okay. We're going to go up to 5. See how that feels for 30 seconds. Then we're slowly going to come down for that last minute. Good. Okay, 15 more seconds at level 5. Nice, slow, steady steps. Good, 5 more seconds. 4, 3, 2, 1. Good, now we're going to go back down to level 4. We're going to do level 4 for 20 seconds. We'll do level 3 for 20 seconds. Then we'll go back down to level 2 for the last 20. Good, 5 more seconds at level 4. All right, bring it back down. Level 3. We're going to do 20 seconds here. This is a great time to focus on that breathing. Big deep breaths in through your nose, out through your mouth. Slow and steady. We're getting that heart rate elevated just enough to start promote that healing. Go down. Speed level 2 for the last 20 seconds. Nice and slow. Heel to toe on your steps. Push all the way through. Drive through those heels when you stand yourself up. Good, 5 more seconds. Good, done. Perfect. Now we're going to move it down to the floor and we're going to stretch. Make sure and stop your stepper. That was a great time to focus on chest openers for a good stretch, just because when you are constantly holding a baby in this rocking position, nursing position, you don't realize how often you're in this position that your body starts to just stay in that position. So it's really good to focus on opening that chest. Even if it's just a simple stretch like this, you can do it against a wall. Anything to promote that chest, just to get open, activate those back muscles. A couple of these, big deep breaths. Good. And then same thing, just bring your arms over. If it feels like it pulls too much, just do a simple reach. Good. Okay. Bring it back in. Perfect. Great. You guys did awesome today. Good work.